Hi everyone, this is Dr. Hall, and we're going to go through the muscles in the medial compartment of the thigh. So here we have our femur, our pelvis, and I've already started by putting in the adductor magnus muscle, right? So this enormous adductor, it adducts the hip. It attaches to the ischium anteriorly, then broadly to the posterior surface of the femur. It has that adductor hiatus, where our femoral vessels are going to dive down. And it attaches to the distal femur because it's an adductor at the hip. So the next muscle that we're going to add in is the adductor brevis. So this muscle is going to attach to the pubis here, and then also to the posterior surface of the femur. Again, if this shortens, it's going to adduct the hip. So the next structure that we're going to add in are our blood vessels. So here I've got an abdominal aorta bifurcating into your two common iliac arteries, internal iliac, external iliac, which becomes the femoral artery once we cross the inguinal ligament. So there's a branch off of the femoral artery that's going to course anterior to the adductor brevis muscle. This is the deep artery of the thigh. We don't yet have structures in place to put the femoral artery where it goes, so I'm going to leave that off to the side for now. But so the deep artery of the thigh is going to course over the surface of the adductor brevis. The next muscle we're going to add is the adductor longus. This one attaches further anteriorly, quite anteriorly, on the pubis, and then also posteriorly on the femur, another adductor muscle. The final one that has the same type of orientation is the pectineus muscle. This is a small muscle that has a very broad attachment to the pubic crest here. And then also, let me see if I flip it that way, if it'll reach better. And then it also comes down and inserts on the posterior surface of the humerus. So there is our pectineus muscle. The femoral artery then travels anterior to these muscles and then is going to dive through that adductor hiatus to become the popliteal artery in the popliteal fossa posterior surface of the knee. We have one final adductor muscle that is a little bit different. It's kind of a long strap muscle, and it inserts on the most medial aspect of the pubis and then courses all the way down to insert on the proximal tibia. So that is the only adductor muscle of the hip that inserts down on the leg. So let's review the structures that we have. Here comes our femoral artery coursing anterior to the pectineus muscle and the adductor longus muscles, diving through the adductor hiatus to become the popliteal artery. If we remove the pectineus, we can see the deep artery of the thigh here coursing between the adductor longus and the adductor brevis. That's the deep artery of the thigh. Our most posterior and largest of the adductors is the adductor magnus muscle, and then this strap-like muscle here to adduct the hip that inserts all the way down on the leg. This is our gracilis muscle. Well, you're just going to have to take my word for it. There we go. There's the gracilis muscle. So those are the muscles of the medial compartment of the thigh.